So it's been a week since the indoor mask mandate was lifted here in Dane County.
Have we seen a rise in COVID cases since then? UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us as he does every Tuesday. Welcome back.
Welcome.
So we're a week maskless. Have we seen any spike, or should we see a spike in that amount of time?
You know, maybe a touch early to see a spike, but you'd think that we'd be seeing some increased cases based on everyone going maskless for the last week, and so far not really. It's looking pretty good.
That's encouraging.
So yeah.
And the numbers are still pretty good so far.
Yeah,
right?
Numbers are still dropping. They're not real high. It's not that we don't have any COVID. COVID's still around. It always will be. But you know, we're not seeing necessarily a plateau in numbers with the mask mandate gone. We're not seeing an increase.
So is the pandemic over?
You know, I think it's going to be hard to say, you know, like pandemic's out for the count, but I think at least locally, things are looking really good right now. It's not to say at some point there couldn't be a variant that causes us some trouble, but there's nothing on the radar right now.
Nothing out there.
Nothing right now. There's places in the world that are struggling with COVID right now. You're hearing about those, but locally and in general throughout the United States, things are looking very optimistic right now.
What does it take to actually achieve an endemic?
I think what you're going to see is the government or the CDC will continue to look at this hospital utilization. All of our metrics kind of shifted to that, you know, whether you're red, yellow, or green. And when we start to see consistent underutilization of hospital beds for COVID patients, i.e. health systems are able to manage that volume without doing anything special and manage all their other patients, that would put us in an endemic state. We live with COVID. We have to do things occasionally to manage it, get boosters, things like that. But we're not having to shut things down. We're not having to mask. We're not having to take these extraordinary efforts to manage patients with this singular disease.
Is the flu endemic, or was never a pandemic?
Flu does get a pandemic on occasion, not to the level that we saw COVID-19, but it does cause, you know, worldwide cases to happen. It doesn't often overwhelm healthcare resources. I think that's, you know, somewhat unique to COVID-19. But not every flu season's pandemic either.
Is there a concern that people might get a little bit lax because we're in it 2 years now and it's going to be warming up, summer, we're all itching to get out, and they might be like, well, you know what, we've already been through 2 years, we know what it's like, we can handle this, and then it's just mayhem.
I think there's some of that. Hopefully it doesn't turn into mayhem, but I think folks who are vaccinated may be putting the booster on the back burner, saying, you know what, cases are really low, I'm really busy, I don't want to go get that booster. Maybe I had COVID not too long ago. I think I'm pretty good there. And that's the one mistake people could make. If you're not boosted, get boosted, because that helps ensure that there isn't a variant. There isn't something that then rains on our parade later. So that's one word of advice I'd give folks, is things are good right now. It feels good. But if you're not boosted, still a good reason to get boosted.
Yeah, vaccine numbers are down, but testing is up for a different reason. People are doing medical procedures.
It's all catch up, right?
I think what you'll see right now is health systems, especially like UW Health, we're doing okay on COVID numbers, but there is a lot of catch up for healthcare, whether it's colonoscopies or mammographies or just surgeries that were put off, you know, replaced hip, replaced knee. All these folks are rushing back now. Health systems have the capacity to do some of this, but it creates for a busy environment. Folks will still experience waits when they're trying to schedule this stuff.
And right now you need a COVID test for some procedures.
For most procedures, we still need that COVID test because the case volume is high enough where we have to make sure that we're protecting those healthcare workers when they provide those services. You know, a discussion that we're having is, you know, at what point would we be able to forgo some of that testing if case levels got so low? Well, fingers crossed. Can you relax them a little bit?
Yes, just a little bit.
Feels good right now.
Right.
Yeah, it does. All right, Jeff, thanks. We'll see you next week.